Good morning, good afternoon, colleagues. I'm so happy again to meet with you through this video. My name is Pasi Amani. Actually the Deputy Global Education Cluster Coordinator on SWESH here in Geneva. And I'm going to share with you a video that will help us in the process of developing the HNO and HRP for 2023. You know, every year, the Global Education Cluster used to support countries' team when it comes to HPC process on developing a qualitative HNO&HRP. And this year, our different specialists will guide us and on different topics on how we can do a better and develop a better HNO and HRP product. So, this video that you are going to watch today, we start with the PIN calculation, the people in need calculation, how to calculate the people in need in education in emergency. And this is one of our key components of the HNO, and we are going to work on that. After that, we are going also to have a short video showing some tips, give us some technical how to develop a quality product on HNO and HRP by working on the previous HNO and HRP that came from different countries. And after that, with different specialists, we are going through different cross-cutting issues like cash, like child protection with education in emergency, like disability and inclusion. We are going to talk also about child protection, child participation, child safeguarding. We are going to talk also about risk GBV and the risk mitigation. We are going to talk also about localization. So with different specialists, we will go through all these topics to show us how we can reflect the need of these topics in the HNO. And while we are working on the HRP, how also we can better reflect those topics in our HRP. So feel free to go through this video to choose the topics that you want and how you want it to can guide you. You will have also the resources, and every time, don't forget, you can reach out to help desk if you have any question. Thank you.
Cluster. In this 10-minute video, I'm going to go through the key features and talking points related to the people in need figures, the resources that we have as the Global Education Cluster have available, and what you should be doing as of now to ensure that we can have a peaceful HNO/HRP 2022-2023 season. Now, I'm sure most of you have seen the figure on the left before. Are outside circles, the total population and affected figures. Now, these are typically calculated intersectorally, i.e. by OCHA, and that's based on population figures of the country and the defined affected areas. Now, based on the context and the intersectoral PIN calculation and the methodology chosen by OCHA, clusters can be involved to varying degrees in this process. But these numbers are not particularly important for strategy development and response planning. However, it's our sectoral specific PIN, our people in need. This is what's essential for developing a cluster strategy. Often, OCHA will use a sectoral PIN or severity figures for aggregating the overall intersectoral PIN figures during that HNO and HRP development. But it's this sectoral PIN figure that serves as an advocacy and funding figure. It can also be very useful for planning our response and creating a response framework. We're not just calculating a PIN for the sake of calculating a PIN, or we're not just doing it to please OCHA. What we want is for an action-oriented PIN, and what we have is a really concrete purpose for the PIN. We're going to use it to inform your targeting, your prioritization, and it's going to make sure that that targeting and prioritization is evidence-based. Now remember, the sectoral PIN does not need to encompass every single education need going. In reality, it's a simplification of that reality. The key thing to remember is that a good PIN is easy to explain, it's easy to justify, and it focuses on the main impact of the crisis on affected school-age children and teachers. If we're able to keep it simple, we're able to ensure it's transparent, other people are able to see how we've calculated it, and we're able to defend it and justify it. Now, frequently, people can say that designing a pin is an IM business. That's for the IMOs to do. In reality, selecting the most relevant indicators to the pin and the severity threshold for each indicator should be the result of a really participatory process. We want everyone involved, our cluster coordination team, our support staff coordinators, our IMOs, but we also want cluster members, those of us that are focal points to the cluster. We need them involved and helping them set their threshold, because they're the ones on the ground, they're the ones seeing where that need truly lies. Now, contrary to common beliefs, people can often see the pin and think, wow, what a calculation exercise, what a load of maths. A lot of people think, blimey, all of those Excel tables. In reality, the most time-consuming part, if we're doing a good, well thought out pin figure, is developing that methodology, is really exploring what is our analysis process. And if we do that really well, if we really work out and create a very transparent methodology, the calculations themselves should actually be relatively straightforward. So how we get to this figure involves a process of logical, evidence-based aggregation of needs. Now, what does this mean? It means we have to think about our context. We have to reflect on the main impact of the crisis on education needs, on your context, and that's going to allow us to pick the most relevant indicators that you're going to be able to use to feed into that pin. Now, the pin figure needs to rely on fact, on strong data. You have to be realistic and use what's available in your context, particularly what data is available to you. And this should be the basis of your methodology. So what can we do now to ensure that we have a peaceful HNO&HRP 22-23 season, at least in regards to the pin? And this is us being very peaceful. Now, if we haven't started already, we should be starting to work on a secondary data review. Now, this isn't only useful for developing your pin, as you'll see with a lot of the things we'll discuss today, it also provides a clear picture of the data landscape available to you, and it helps you to develop your full analysis of needs, which is going to then feed into your HNO&HRP narrative as well as the pin. As we've said, that helps seeing what data is available. Now, can any data be fed in? Unfortunately, no. What we need to be doing is considering the scope of the exercise. Who are you including in your calculations? Are you including displaced people, for example? What are the age groups are you including? Particularly with education, are you including pre-primary school data? A really key thing is that the data also needs to be aggregated or disaggregated specifically to the HNO unit of reference. What is the geographic level set by OCHA and those leading the HNO process? Can the data that we have be used at this unit, either through an aggregation or a disaggregation? And is it reliable and usable at this level? Now, at the global education cluster level, what we have worked really hard to do is make sure that we can base the pin on either enrollment or attendance data. And this is going to be your decision between enrollment or attendance is going to be based on the quality and the availability of the data. How strong is that data? Now, what you can do is you can assess the quality of the information, assess the impact of the biases to these data, as both of these data will have biases. And what we have done at the global level is made sure that this data is available to you in one form or another, either through the EMIS or through the multi-sector needs assessment. So what you need to do is you first need to select your whether you're doing attendance or whether you're doing enrollment. And then what you'll need to do is you'll need to select a couple of severity indicators. And these severity indicators are going to be different for whether the child is enrolled or not enrolled, whether the child is attending or not attending. And that's because a child in school is going to have a different experience of a humanitarian situation, a humanitarian crisis. We talk about shocks a lot. They're going to be exposed differently to the impact of any shocks or humanitarian crisis. What we're looking to do is we're going to look to identify different severity indicators for the two groups in order to allow us to identify the severity of need, that depth of need that each of these childs have. So as far as possible, core indicators, those attendance and enrollment indicators, should be complemented by information on, for example, learning environment, on potential protection concerns, or even indicators that are not specific to the education if they're relevant to the wider context. And it's your context that should be driving these decisions on what severity indicators you're using. For example, children who are going to school, who are in school, they might still be in needs of education assistance if the learning environment themselves are considered to be of very poor quality. For example, we know that humanitarian contexts, certain contexts may involve teacher shortages and overcrowding of classrooms. In that situation, we can use the pupil-teacher ratio, and that can be a really good indicator for measuring the severity of need, even when a child is in school. Even more so if we have a context where schools or teachers or students themselves are frequently targeted by armed groups within the context that we work in. The numbers of attacks on schools per admin level at that OCHA unit of measurement can be a really good indicator of need. Now, for children that are not attending or not enrolled, as again, it depends on which ones we select. Now, are they likely to be working? Is this a context where children aren't in school because they need to support their family, domestic labor? Are they working agricultural labor? So on and so forth. Do we want to include relevant indicators on child labor, and are those indicators available? Also, a precarious food security situation can have multiple impacts, not only on learning outcomes, but also on children or teacher presence, for example. If we see an area that's at risk of famine, low productivity for food production, frequently that low productivity can mean children coming out of school, either because they can't afford it or because they need to work to produce more food for their household. Now, again, what you choose really will depend on data availability, especially given those HNO constraints, that population scope, the geographical unit of reference, and so on will very likely be key factors when making your choice of indicators. So at the global level, we've prepared two different ways of calculating a PIN, which should ensure that a good quality PIN can be developed in any context, no matter what data you have available. Now, if you have school level data, you can implement what we're calling the advanced GEC methodology, and the full guide will be available on that. If you don't have school level data, as many contexts don't, this isn't an issue at all. We have also got the GEC simplified methodology. Now, this consists of using your enrollment data and attendance data and choosing those severity indicators that we discussed. And on this slide that will be shared with you, we have the link to the resources that we have available. So the first one, we discussed doing our secondary data review. This is part of our needs assessment package. And we've got that package available in every language that we have. We have Arabic, we have Spanish, we have French, and we have English. So hopefully we have a language there that you can understand. You can go through starting from page 15 and really understand how and why we are doing this secondary data review. Also, coming up this summer, we're looking to share PIN methodology. Before that, we also have a presentation on how we should design our PIN methodology. Now, if you feel confident and you want to move ahead, you can have a look at this link and begin your preparations for your PIN methodology already, trying to get your head around the concepts that we've spoken about today. But if you don't understand when going through that package, certain things, we are going to be sharing a PIN methodology template and guidelines, and we're also going to be sharing methodology and calculation examples. And the idea of this is to make it as easy as possible for you to transparently calculate your PIN without giving yourself too much of a headache. That is really our target over the next few weeks and months, is to make sure this pin figure isn't a headache for you guys. We want to make sure that we're providing enough support, that the pin figures are transparent, they're well sourced, they're coming from good quality data where possible, and we have something that we can justify as we use that for response planning.
Good morning, everyone. My name is Elisa. I'm the Global Education Cluster Senior Knowledge Management Specialist. Today, I'm going to present to you a tip sheet that the Global Education Cluster has developed to guide you in the development of quality HNOs and HRPs. Okay, so tip sheet is a very practical and straightforward document. It's a couple of pages that you can use as a sort of a backup guidance as you develop your HNOs and HRPs. As you know, the Global Education Cluster team is available to review your draft HNOs and HRPs and provide input and comments. So feel free to reach out to the GEC help desk or to your focal point. So starting off with the ribbon which with numbers, that is basically starting your education section of both HNOs and HRPs. Do remember to specify pins and targets disaggregated by gender, female versus male, age, children versus adults, and the overall percentage of pin or target of persons with disabilities. We wanted to show you a couple of examples because we have noticed that sometimes there are missing information which can potentially create misunderstanding to a donor or anyone else who is not familiar with the context and reading your HNOs and HRPs. To give you an example, the example 1 HNO 2022, as you see, the people in need are 1.9 million. And 1% of women and 98% of children. Now, someone not really familiar with the sector would actually be surprised that the sector, the cluster, is only targeting 1% of women / female. There can be, as you can see, there can be a misunderstanding, or it can create a bit of confusion because ultimately it is not telling us what's the percentage of females in general, meaning women and girls that are being people in need in that specific country. Another example of an HRP 2022. As you can see, there is a good disaggregation of children and disabled. However, we don't know how many adults versus children. As you can see, the target is basically exactly split between girls and boys. But then one would wonder, is the cluster not targeting teachers at all? Another example, the example 2 of the HRP, as you can see, there is a good disaggregation of disabilities. However, there's no information about gender of children. We wouldn't know what's the percentage of girls being targeted versus boys. We would also encourage you in the HRP, once you have calculated your funding requirements, do a quick pulse check of your overall funding requirements and the targets. So you can get a better understanding of what is the unit cost. Of course, if you're working on an activity-based budget or the budget was calculated already by targeted people, that may be easier because that's already part of your calculations. If you received the information from the partners, then remember to do this because it provides you already with a bit of clarification or it can guide you to develop a rationale as well. There's a good example of an HRP 2022 that actually guides you and provides a very good detailed explanation of the cost per beneficiary increase of that specific year, and it was included in the HRP education narrative. Remember also in the HNO to include specific reference to any needs assessment, SDR, secondary data review, and individual reports. We're including here a couple of examples of 2 HNOs that actually do provide specific reference of the data source of information that they're including in the HNO. There's also something else that we're seeing sometimes missing. When we analyze HNOs and HRPs, we see a long list of needs identified in the HNO, but then the HRP doesn't really match. It is not sort of reflecting the response to the needs that have been identified. And so in order to guide you in this process, you could potentially as well develop a short matrix of HNO needs, the needs that you have identified in the different reports, analysis, assessments. And then when you develop your HRP, look at those needs and make sure that they are reflected in a way or another in the HRP. And we fully understand that some needs cannot be covered by the cluster. However, it is equally important to document this and to clarify why the cluster is not going to be able to address specific needs. In both HNO and HRP, OCHA, most of the case in the guidance, in the template, there's a section that specifies needs monitoring. So in the HNO, the monitoring section should actually refer of the needs. How is the cluster going to monitor the any change of the needs, any change of the situation? However, in the HRP, the focus of the monitoring should actually be on the cluster response. How are the partners responding to those needs? We have also noticed that in a number of HNOs and HRPs, education levels are not really specified. So when you describe both the needs and then also the response, let's say that I'm a donor particularly interested in early childhood care and development, it's very rare that I can find HNOs or HRPs where I can clearly understand that that cluster is actually addressing and emphasizing the needs of the pre-primary. The same for other sectors. We really need to try and look. Sometimes it's the age group which is included, but it doesn't really specify whether the cluster, for instance, is at all targeting secondary level or specifically mostly targeting primary level. So again, in your narrative, both the HNO, when you talk about the needs, and also in the HRP, remember to specify which is the area of focus of a cluster. Does it cover ECD up to secondary? Does it also include tertiary, for instance? Or is it really specific and the priority has been mostly primary? It's very important, again, also if you look at this from a donor perspective, because you may actually potentially miss some funding opportunities of donors that are particularly interested in one or the other area. When it comes to alignment with other sectors, harmonization and alignment with national systems, it's very important that we start working more with other clusters. The Global Education Cluster has done a lot of work with CPAOR. As you know, we've developed the guidance, CPA collaboration, but it's equally important as well. And we're seeing actually in this year HNOs and HRPs more cross-reference with other sectors. So do make sure that you make a specific effort to reach out to other clusters and that cross-reference is not just included in HNOs and HRPs, but also actually that you're looking at maybe a couple of key actions, key areas of focus that you would like to work with the other cluster during the upcoming year. We've also noticed more and more, which is encouraging, that education clusters are making reference to national education system. And we have included here an example, for instance, of a section in the HRP of a good example of humanitarian development nexus. Make sure as well that it is not just about explaining how the strategy or the HRP is linked into the national education sector plan, but also how the cluster is going to engage more with development partners and looking at specifically the influencing part. That's all. This is in a snapshot, very short representation of the quality tip sheet for HNOs and HRPs. We're going to share the link to the tip sheet, but also again, feel free to reach out to the help desk and or your focal points if you need any support during the development or review of your HNO and HRP. We're always here to help you. Have a lovely day.
Hi everyone, I'm Adama Jallo. I'm the Child Protection and Education Emergency Coordination Specialist from the Global Education Cluster. As maybe you know, both education and child protection sector have important and complementary role in contributing to children's needs to survive, develop, and thrive. Based on the centrality of protection, intersectoral approach reflects the interconnected need of children and emphasize our collective responsibility to protect children. So some benefits include response planning that is more aligned with children needs, data available and quality are improved and sector work together in need assessment and analysis. Response quality is enhanced with technical input and integrated services from both sectors. Working together during targeting also reduces duplication of services and maximize impact of available funds. And we know that partners often deliver multi-sector services. Coordination can encourage and facilitate this. So breaking down sector silos and fostering integration. And finally, monitoring overall contribution to common response area improves understanding the overall response progress and remaining gaps. And we know that there is already a lot to do during the HNO and HRP preparation. So I'm going to highlight some way to save time and maximize effort through collaboration with child protection colleagues. So there is a clear opportunity for child protection and education during needs assessment and analysis. Both sectors focus on similar age group and need similar information, and both face challenges in data availability and quality. So what are the key action to take? This seems obvious, but think about the information we need for the education HNO. They might have it. Child labor, child marriage, vulnerabilities and risk to children, etc. And then assessment. Maximize the opportunity to include your question in any child protection assessment that are planned. Child protection usually does household level assessment, as most of you know, which is a much better way to get information on out of school children, risk and barriers faced. If you are planning an assessment, reach out to your child protection counterpart and ask for few child protection questions to include. This could help you to understand the child protection related barriers to children, access to school, and then people in need and prioritization. Both sectors should make sense together since they are often the same children. Child protection and education sector provide services to many of the same children, share common partners, and often implement in common spaces. Therefore, it is critical that our response planning and targeting are coordinated. So country clusters and partners are frequently sharing that when both child protection and education deliver similar activities or integrated activities. This become a confusing area and something that we can improve on to maximize effectiveness and efficiency. For example, if both sectors are doing the same or similar activities, example PSSS, or if child protection activities are located in school, example school-based referral mechanism, the key point here is to agree what each sector will do what and document this in your HNO. This is important. This make it clear for fundraising, project sheet, also save the IMOs a lot of time later on when this reporting or double reporting creeps in from confused partners. Targeting for similar or integrated activity, check your target with child protection to make sure you are not targeting the same children, therefore saving you money. Finally, you need to know that you are not alone in this work. Your child protection colleagues are receiving the same messages, and the GC and the Global Child Protection Area of Responsibility is ready to provide support. As you can see, you can also refer to the different tools that we have in here, which is the child protection and education education, sorry, in emergency collaborative framework package, which is available in English, French, and Spanish. You have also the tip sheet itself for the HNO and HRP collaboration, and also do not hesitate to get in touch with the GC or the CPOR, or you can directly contact your help desk or me, Adama Jallo, for the support. Thank you for your attention.
AAP, Accountability to Affected Population and Children, in the Education Cluster 2023, HNO and HRP. So first thing first, this is just a reminder of the definition of child participation that you should already be familiar with. Child participation in humanitarian action promotes the right of children to be heard, express their views, and to have their views considered seriously in decision-making processes that affect them, as enshrined in the UN Convention on the Rights of the Child. Child participation ensures that children's rights are not simply reliant on the goodwill of adults. Child participation is to be meaningful for children and conducted ethically, in line with child safeguarding principles. So by now, you might be wondering, why is child participation an education cluster responsibility? It is, after all, an organizational methodology. So what can education clusters do about it? Actually, education clusters can do a lot about child participation. Firstly, because child participation is not an issue for individual organizations alone. It is a system-wide issue that needs a system-wide accountability and action. Then remember that children have a right to engage in humanitarian actions and processes intended to support them. Therefore, child participation makes the education response more accountable to children. It is important to remember that children can provide clarity on the impact of the crisis on their learning. Their needs and priorities can therefore inform the design of a more quality, more accountable, and better coordinated education response. Through implementing child participation, efforts on child safeguarding and PSCA can be supported. And then remember that children's voices are the strongest advocacy tool that we have as a sector. Children's perspective can be used to influence decision makers to prioritize and protect education. So collectively, we are all responsible for doing everything we can to ensure that children's voices are heard and considered throughout the education response cycle. Now that you understand that child participation and AAP are important elements of a safe, accountable, and coordinated education response, here is an overview of how child participation and AAP can be integrated in coordination functions. Education clusters can work on child participation during needs assessment and during the design of education responses and strategy. It is important to ensure that identified education needs include children's perspectives and that responses or strategies address children's priority issues. To achieve this, you should implement meaningful and safe child participation through ad hoc consultations. Education clusters can work on child participation during the monitoring phase of the HPC. It is important to ensure that education partners deliver on the commitment to provide children with safe education responses. Therefore, monitoring children's satisfaction with received aid is important, and you can integrate findings in your cluster information management system. Clusters can also collaborate with the AAP or community and communication engagement working group when existing in country. And as a cluster, you can support in mobilizing technical and financial resources for improved child participation and AAP practices. More specifically, here are some suggestions on how your cluster can include child participation and AAP elements in your HNO. And following, we will see the HRP. During the needs assessment and analysis phase in preparation for the HNO, you could survey education partners' child participation and AAP practices and knowledge through existing online forms, and therefore reference identified gaps and needs in the HNO. It would be fantastic to conduct an ethical and meaningful child participatory joint education needs assessment in this phase, and therefore include children's identified needs and issues in the HNO analysis. This process would also help you linking your work on child participation to the child safeguarding workstream that you could also work on. Regarding the HRP, during the strategic planning phase to design your response, you should make sure that the response meets the notion of safe and participatory education programming that is compliant with child rights, ensures child protection and gender mainstreaming. It includes GBV, risk mitigation, and child participation and inclusion actions, as well as child safeguarding, PSCA, and is compliant to the do no harm principle. Through the HRP, you can also identify funding opportunities to strengthen your partner's child participation and AAP capacity, which would be also a great opportunity to link your work on child participation to the work stream on localization if you target in particular national and local partners. During the HRP phase, you will be asked to vet partners' project sheets. Here, you could prioritize those that include child participation and AAP actions within the implementation strategy. For monitoring purposes in the HRP, you could design and include monitoring indicators on child safe and participatory programming. Here are some examples of indicators, but there are more available to you. And you can also include in the HRP a strategy to meaningfully and safely involving children during monitoring of the HRP implementation, so that corrective measures can be also based on children perspectives. The HRP can also mention how during the implementation phase, you will work with partners to design child-friendly, gender-sensitive, and inclusive feedback and complaints mechanisms. And this is, again, an opportunity to link your child safeguarding workstream and the child participation workstream within your cluster. In summary, here are very basic top tips that you could bear in mind to ensure that your HNO and HRP meet child participation criteria. For example, during the HNO design or at the review stage, you should check whether children, including children with disability, have been involved in needs assessment. If not, why not? Do partners in your cluster regularly or at least occasionally consult with children in their education programs? If not, this could be seen as a gap. Regarding the HRP, ensure that you include approaches to measure satisfaction with the received assistance for boys, girls, including children with disability. Include strategies to strengthen the institutional capacity of local actors in child participation and AAP, and include indicators to monitor safe, participatory, and accountable education responses. Finally, here are resources designed by the GEC on how education clusters can embed child participation in HNO and HRP. More GEC resources on child participation in education coordination are also included. Thank you very much for listening. I wish you good luck, and don't hesitate to be in touch if you want to work together on child participation in your HNO and HRP. Thank you.
Assistance, or shortly CVA. It is a form of assistance when cash and vouchers are given directly to individuals or household, or at the maximum to community recipients. Governments and other state actors are excluded from this. This is very important for the education sector because this means that teacher incentives and cash grants to schools are not a form of CVA. CVA for EIE addresses economic barriers that prevent children and adolescents from accessing and attending schools. This means that CVA alone is not enough to address education needs if other education-related needs are not simultaneously addressed. It is important to address both demand side and supply side barriers to education. So concretely, what does it mean for us when we are preparing the HNOs? It means mainly that we need to address a number of questions, such as what are the education-related expenditures of the households? Are they able to address these expenditures, to cover them fully or partially from their own budget? If not, what is the gap? Are the markets for essential education-related goods and services functional? And do affected people have access to them? In order to answer these questions, sometimes it is enough to conduct a secondary data review using tags such as financial barrier, education-related expenditure, education-related markets, or cash feasibility. There are a multitude of data sources, such as statistics coming from UNICEF and other organizations, demographic health surveys, and all the information produced by cash working groups. If data is insufficient at this stage, then of course it will be necessary to conduct primary data collection, and this can be done together with other sectors and with the cash working group, with the ICCG, mainly through the MSNA, which usually collects information on household income, expenditure, and debt. All this is described in greater detail in the GEC resource on consideration for CVA in EIE needs assessment, which is available in multiple languages. And you have here a couple of examples of what needs to be included in HNOs in order to be prepared to consider CVA in the next step. Once, well, let's go first through an example of process of tool which collects sometimes very useful information for education partners. We have a very good example from Somalia when joint market monitoring was conducted together by the WASH, shelter, and education clusters. And this initiative mainly monitors prices and stocks, mostly for items included in the minimum expenditure basket and for teaching materials as well. You have the one of the reports of this initiative included here in the slide. So once all this information is collected and analyzed at the needs assessment stage and reflected in the HNO, the next step is response analysis. And it's here that you have to ask yourself whether CVA is appropriate to address education needs. And if it's appropriate, is it feasible? Then if it's feasible, you can develop the response objectives and include CVA among response options. If CVA is not possible, is not feasible, then we can still ask ourselves if the feasibility can be improved. For example, by supporting traders who are selling education goods such as school materials or uniform to improve their stock. If this is not possible, then most probably other options will be more appropriate, such as distribution in kind. Very briefly, when we get to the HRPs, there are very clear OCHA requirements since 2020 on how to include CVA in the HRPs. And this means that you have to be clear whether the CVA modality will be used, state what percentage of the response will be delivered by using CVA, and also be clear on the number of people targeted with CVA. Also, you need to include evidence on how you determine the use of CVA, and also you need to include non-CVA specific indicators, which are outcome-based. And you'll also find a number of useful examples taken directly from HRPs from 2022 and 2021. Once cash is included in HNOs and HRPs, this has to be tracked in cluster 4Ws. And OCHA has given us a number of fields that have to be included. These are at the very minimum the modality used, whether it's in-kind, service, cash, or vouchers, then the transfer amount and the type of transfer, meaning if it's a one-off transfer or a recurrent one. Then there are also some optional fields to be included, such as delivery mechanisms and conditionalities. You will find more in the GEC one-pager developed specifically for Education Cluster Information Manager. Just a quick reminder that the use of CVA in the 2023 HNOs and HRPs will be monitored by the GC, as it has been done in previous years. And it will be done mainly to consider the aspects that I've mentioned already in this presentation, and which are minimized for the purposes of monitoring. Also, last but not least, I wanted to remind you that there are a number of CVA in EIE related resources that are available in the GC library, and which you can access also by clicking on the links in this slide. And with this, I thank you very much, and I'm looking forward very much to hearing your questions, if any.
Hello there, I'm Pamela Marie Godoy. I'm a gender-based violence technical specialist, and I work closely with the nutrition, education, WASH clusters, and child protection area of responsibility in terms of translating technical guidance on GBV risk mitigation into actionable program interventions and ensure that our humanitarian programming is safe and accessible for women, girls, and other vulnerable groups. I'm looking forward to working with you to ensure that GBV risk mitigation is integrated in the cluster's humanitarian programming cycle in correlation with other cross-cutting concerns such as disability inclusion, localization, and accountability to affected populations. As a review, GBV risk mitigation aims to reduce exposure to gender-based violence and ensure that humanitarian response actions and services do not cause harm or increase the risk of violence. Our main reference is still the Interagency Standing Committee guidelines for integrating GBV interventions in humanitarian action, and there is a specific guide for education cluster. We may look at GBV risk mitigation as a means to an end. When we reduce the risk of gender-based violence by carrying out well-designed education interventions, and when we make safety, dignity, and access central to our education in emergencies programming, this ultimately contributes to the education cluster's ability to meet its core standards and targets. Last year, we developed a toolkit with up-to-date practical resources that education cluster colleagues can use to understand the differentiated needs of girls and boys in all their diversity and recognize intersecting forms of discrimination that boys and girls face to be able to strengthen GBV risk mitigation across the humanitarian programming cycle. When you review the toolkit, you will notice that there are standard activities that can be implemented as part of GBV risk mitigation. All sectors should be working toward integrating these activities as basic GBV risk mitigation measures where possible. The first one is consulting with women, girls, and children. We know that women, girls, and children are experts on their own safety, so we want to get feedback from them on which GBV risk mitigation actions would best address their barriers and risks. There are existing resources, including those that Serena has put together on engaging girl and boy children and taking into account their perspectives to inform the education cluster's response planning and decision-making processes. Consultation with women, girls, or children may be difficult in some contexts, in which case other options could be to use the results of rapid gender analysis reports or consulting with women or adolescent-led or children-focused organizations. The second one is about ensuring that all humanitarian personnel who engage with affected populations should be trained on how to properly receive disclosures of gender-based violence in a non-judgmental, non-discriminatory, and confidential manner. This is where close linkages with gender-based violence and child protection coordination groups are crucial, as they establish and update GBV referral pathways for child and adolescent survivors of GBV. A referral pathway is a flexible mechanism that safely links GBV survivors to supportive and competent services such as medical care, mental health and psychosocial support, police assistance, and legal support. So we closely coordinate with GBV and child protection actors to have up-to-date information about the availability of these life-saving services. In the toolkit, you will also see reference to the availability, accessibility, acceptability, and quality framework. This framework was originally developed for the healthcare sector, and it can also serve as a useful tool for assessing other types of services. In our case, identifying barriers girls and boys may face in accessing education-related humanitarian aid and services. So we use this as a tool to identify barriers that girls and boys may face in accessing humanitarian aid and services, which, if not addressed, may increase the risk of multiple forms of gender-based violence. Using the AAQ framework, this is how we may understand, for example, how the Somalia Education Cluster identified potential barriers that impede access to education services and that may increase risk to gender-based violence based on their particular context. They flagged the distance to school and lack of gender-segregated latrines in schools, including lack of menstrual hygiene management materials and girl-friendly space within schools. They also pinpointed to household chores that are disproportionately taken on by adolescent girls, which may lead to their dropping out of school and exposure to various forms of gender-based violence. They also pointed out that girls with disabilities face additional barriers in accessing education services. When you look at the cluster's humanitarian response plan, they have interventions to address the lack of segregated facilities, the lack of gender segregated facilities. The cash and voucher assistance for education is supposed to support out-of-school children to immediately return to school and perhaps address the specific barriers faced by girls and girls with disabilities. It wasn't clear, though, how the distance and lack of hygiene or sanitary materials were specifically addressed. So part of the toolkit that I referenced earlier, we also developed this so-called matching matrix. This matrix was primarily developed based on requests from multiple cluster coordination teams in the field to help them match barriers and risks faced by women and girls with concrete GBV risk mitigation measures and indicators. The matrix captures examples that were collected during the humanitarian programming cycle review exercise that was done in 2021. This is a work in progress document that will be continuously reviewed and updated based on documentation from the field. Cluster coordination teams in countries can use the matrix when developing their humanitarian needs overviews, humanitarian response plans, assessments, M&E tools, funding allocation criteria, and even cluster capacity building plans. The matrix should also be used in conjunction with other core tools for GBV risk mitigation, such as the AAQ framework, safety audits, and consultation with women and girls and children. It can also be used to generate in-country reflection on GBV risk mitigation and identify priority needs and gaps. Before I finish this recording, I would like to circle back to the availability, accessibility, acceptability, and quality framework. One of the things that I prioritized when I assumed my post in April this year was to customize further the existing AAQ framework for the education cluster and align it with the minimum standards indicators outlined by the Interagency Network for Education in Emergencies. As you know, the Interagency Network is currently updating the minimum standards, so we are in touch with INEE colleagues to ensure alignment of the AAQ framework with the revision process of the standards and indicators. I look forward to engaging with field colleagues to further shape this framework to make it user-friendly and relevant for education cluster members. So that's it for now. I shared all the relevant links and documents with Pasi. I look forward to seeing you in the live Q&A sessions. Thank you.
Welcome to the 2023 HNO&HRP webinar of the Global Education Cluster. My name is Serena Zanella, and I'm the GEC Child Safeguarding and Child Participation in Education Coordination Specialist. Today, I'm talking you through how you can embed elements of child safeguarding and of PSCA in the Educational Cluster 2023 HNO&HRP. First thing first. So this is just a reminder of the definition of child safeguarding that you should already be familiar with. Child safeguarding is the responsibility that organizations have to ensure that their staff, operations, programs, and associates do no harm to children. Child safeguarding consists of the organizational policy and procedures, including a code of conduct, to prevent and respond to harm to children caused by the organization's staff and programs. By now, you might be wondering, why is child safeguarding an educational cluster responsibility? It is, after all, an organizational function, so what can educational clusters do about it? In fact, educational clusters can do a lot about child safeguarding and PSCA. Firstly, child safeguarding and PSCA are not issues for individual organizations alone. They are system-wide issues that need system-wide accountability and action. Secondly, while child safeguarding is important for every sector, it is particularly important for education partners due to the amount of children we have contact with daily. Ensuring that children are safe from harm potentially caused by NGOs, staff, and programs is a key element of a quality and accountable coordinated education response. For this reason, education partners must commit to be safe organizations for children through child safeguarding and PSCA improved practices in order to contribute to minimizing risk to children in education responses. And then remember that in emergencies, child safeguarding violations increase. So finally, collectively, we are all responsible for doing everything we can to be a safe sector for children by learning together and supporting each other. Now that you understand that child safeguarding and PSCA are important elements of a safe, accountable, and coordinated education response, here is an overview of how child safeguarding and PSCA can be integrated in education cluster coordination functions. Education clusters can work on child safeguarding at the institutional level. So they should promote that all education partners are safe organizations for children. For example, you could ensure that all partners in your cluster have a child safeguarding, PSCA, code of conduct, policy, and system in place. Education clusters can work on child safeguarding at the programmatic level by promoting that all partners deliver safe education programs for children and personnel. And here it is paramount that clusters understand what child safeguarding, child protection, and GBV, including sexual exploitation and abuse, risks may affect children in EIE responses and plan mitigations in the HRP. Collaboration with the child protection and GBV subclusters is very important, as well as with the PSCA network in country. Finally, education clusters can do a lot also in supporting the mobilization of technical and financial resources for improved child safeguarding and PSCA practices. More specifically, here are some suggestions on how your cluster can include child safeguarding and PSCA elements in your HNO and following in the HRP. So starting from the HNO during the needs assessment and analysis phase, you could survey your partner's child safeguarding and PSCA practices and knowledge through an available online form, and therefore reference identified gaps in the HNO. It is also very important that during the needs analysis phase, you identify child safeguarding, child protection, and GBV, including SCA risks in education programs. And this could be done ideally through child participatory consultations or through secondary desk review or during a partners workshop or even during an education needs assessment. Identified child safeguarding, CP, and GBV SCA risks are to be included in the HNO analysis. And then notice how in doing this, you can link your child safeguarding work to the GBV risk mitigation and the child participation work streams. Regarding the HRP, you can, during the strategy planning phase, ensure that your HRP document includes mitigation measures for the previously identified child safeguarding, CP, and GBV, including SCA risks in education responses. And once again, this is how your child safeguarding work can be linked to the GBV risk mitigation work stream. As part of the HRP, you could also identify funding and technical opportunities to strengthen education partners' child safeguarding and PSCA capacity. And here you can link the child safeguarding work stream to the localization work stream, in particular working on strengthening capacity of local and national organizations on child safeguarding and PSCA. As part of the HRP, when the project vetting phase comes, you should ensure that you prioritize those partners that have submitted project sheets that include child safeguarding and PSCA actions and budget to keep children safe in their education programs. As part of the HRP, you should design and later on monitor child safe and participatory programming indicators. Here are some examples, but there are more available to you. And once again, you could design child safeguarding and PSCA related indicators that also link to the GBV risk mitigation workstream. And as part of the HRP, you could describe how your cluster can influence the partners' design of child-friendly, gender-sensitive, and inclusive feedback and complaint mechanisms, which is also how your child safeguarding work will be able to link into the larger accountability to affected population workstream, as well as connect into the child participation workstream. Here is a quick summary with some real top tips of how your HNO and HRP can be better compliant vis-a-vis child safeguarding. So for example, when you're designing the HNO, look at the following review criteria. For example, ask yourself, was an analysis of child safeguarding, child protection, and GBV, including SCA risks of different population groups by age, gender, and disability done to inform the needs analysis? And if not, consider this to be an element to include in the HRP. Use sex, age, disability disaggregated data in your HNO, and then ask yourself, do all education partners in your cluster have a child safeguarding and a PSCA policy and a code of conduct? In the HRP, once you're designing your document, bear in mind, for example, the following review criteria. Does the response address barriers and child safeguarding, child protection, and GBV, including SCA risks as identified in the HNO? Make sure that you include monitoring of safe access to and use of services and facilities, as well as of child-friendly feedback and complaints mechanisms, for example, by adopting safety audits. Include strengthening the institutional capacity of local actors in child safeguarding and PSCA in your HRP, and ensure that there is at least one indicator related to access to services and facilities, as well as to feedback mechanisms disaggregated by age, gender, sex. Finally, here are some available resources designed by the GEC on how education clusters can embed the child safeguarding in your HNO and HRP. More GEC resources on child safeguarding in education coordination are also included. Thank you very much for listening and good luck. Stay in touch if you want to do more on child safeguarding in your HNO and HRP. Thank you.
Good morning and good afternoon. My name is Ben Munson, and I am the localization specialist with the Global Education Cluster. I've been asked to do a short video presentation on how it is possible to localize and input localization into the HNO and HRP processes. I believe this is going to be part of a training package that the Global Education Cluster will be rolling out. So hopefully this will complement the rest of your training. I'm working on all things localization with the GEC, and you can find my email address and contact details on this opening slide. So as you hopefully know, the HNO and HRP processes are part of the humanitarian program cycle process, which happens most years every year. And why is it so important that localization is part of this process? Well, as you hopefully know, localization should be mainstreamed into all of our humanitarian processes. However, as these are such big parts of this process, it becomes a key opportunity for us to influence how local and national organizations are represented in these processes. And just to really highlight and underline how important local and national partners already are, in the education clusters that we operate in, 64% of our membership is by national and local actors, and in the child protection subsector, this is at around 50%. So you can see that local and national actors are really the ones who are driving forward our work in humanitarian contexts. So the way that we can really increase the participation in the processes and what the benefits of these can be are that the process becomes more accountable, transparent and inclusive to the affected people, because it's usually organizations that are from those communities and who are representing those communities who are now involved with this process. So it becomes the link back to the community is much stronger, and therefore it becomes more accountable to them. Additionally, it reaches more people with quality services, because local organizations are usually strong members of their community already. They have better links to the community, and therefore they can scale up responses in ways that usually international actors can't. So they are meeting a need and becoming close to the communities in their response as well, leading to a higher quality of delivery. And also it's usually more tailored to affected population, because you're getting inputs from national and local actors into this process, which is therefore driving the strategy of the cluster at the national level. So therefore you're really getting buy-in from community members into this whole process. So these are some of the clear tangible benefits of localizing the HNO and HRP processes. And now we can see how this can be done in a bit more detail. Okay, so the HNO process is where data is gathered that will inform the current situation of the context or the crisis in a given location, which then informs the humanitarian response plan afterwards. And we've broken down the HNO process into three main stages. So before you start planning, during the HNO process, and then during the analysis of the HNO data. And these are different ways where local organizations can become more involved, and this is driven by both the cluster and also the partners of the education cluster. So really announcing these processes as early as possible will only increase the level of buy-in of local and national actors, because it will give them time to understand the process and understand how they can get involved in the process. And increases in this inclusion will be good if you can translate this communication into local languages to again reach more local and national organizations. Also, when doing a HNO process, having a diverse group of actors involved, whether that's organizations from the affected population, whether that's refugee groups, but also making sure that you're having a good blend of diverse gender-led organizations, as well as organizations of people with disability as well, so that all of their needs are also reflected in the way that this process is rolled out, and ensuring those questions are mainstreamed into the process as well. And then before starting as well, it's good to map out actors by geography. This allows basically to make it easier for local and national actors to be involved. If you are allocating actors to do assessments in their location they're based in, it's much easier for them to be involved in that process as well. And also, there might be some activities that will be much more impactful if a local or national organisation takes that lead, whether that's doing key informant interviews or focus group discussions with community members, all the way through to talking to head teachers. These things can be done better sometimes by local and national organisations. Additionally, during the process of conducting an HNO, if you can collaborate with other clusters, you usually can get a larger reach, especially when the context you are working in has access barriers or is a very large context. Collaborating with like-minded clusters such as the child protection subsector is also a good way to reach a wider geographical area. Also, pairing up agencies such as INGOs and local actors that work in similar areas to conduct the assessment together. This will allow them to collaborate and also share resources such as financial resources and also logistic support if necessary, so that they can reach the communities together. And then from a perspective of during the analysis phase, make sure that you credit all organizations that were involved in the process, especially local organizations. Additionally, ensure localization is referenced where possible. The more that it's involved in the HNO process, the more it can be reflected then in the HRP process as well. And also make sure to disaggregate data that's collected by the type of organization. So, for example, if you're talking about funding trends over the last few years, make sure you're not just talking about the clusters funding, but making sure you break it down into which types of organizations are receiving that funding, so that it's clear whether the funding is going to local, national or international organizations. So that's the humanitarian needs overview. There's a few simple tips here to localize it. And then on top of that, we're now moving on to the humanitarian response plan. So at this stage, you've already done your humanitarian needs overview. You've got an idea of exactly some of the key themes and needs and people requiring support. And then you're developing your strategic response plan as well. So in this process, some comments and reflections to increase localization are really to make sure that local and national organizations are involved in this whole planning phase, so that objectives of your strategic plan, response plan, and locations, and also who is being targeted, are jointly agreed by national, local, international, and cluster members as well. Also clearly reference institutional capacity strengthening activities where possible. We know when institutional capacity strengthening activities aren't mentioned in humanitarian response plans, they're much harder to convince donors to fund. So ensure they are included at this stage. In terms of resource mobilization, again, we're talking about institutional capacity strengthening. Ensure that you're using all possible funding mechanisms, such as country-based pool funds, to access these types of funding, because we know that the country-based pool fund is a very flexible funding mechanism that can allow for these types of funding activities. And also remember to include flexible funding and overhead costs for national and local actors in allocations where possible. We know that international actors and UN actors always receive overhead costs, but national actors often don't, which means that they're often not able to respond in the same ways that international actors are, or have a flexibility at their HQ level. So ensure that the fair treatment is received by all. And then in terms of implementation and monitoring, it'd be great where possible to really incentivize partnerships, which include coaching, mentoring, and capacity strengthening as well. So where it's not just a direct implementation relationship. Additionally, on top of that, it's also important that kind of equitable partnerships are also and consortiums are also encouraged between international and local actors, because without this, the amount of funding going to local actors will not be as large. And then finally, wherever there's good practice of localization, make sure these are captured, documented, and shared between members and also other clusters, so that they can be further included in future response plans. Okay, so that was a very brief overview on how to localize the humanitarian needs overview process and also the humanitarian response plan. Thank you very much for listening. If you'd like more detailed resources, these can be accessed via the Global Education Cluster and through the HNO training that we do each year. But if you don't have contact for them, please do reach out to either me or the GEC through the help desk. Thank you very much.
My name is Anaïs. I'm a cluster coordinator with the Global Education Cluster and the focal point for disability inclusion at global level.
Hi everybody, my name's Kirsten. I'm Program Specialist for Disability Inclusive Humanitarian Action at UNICEF and supporting the clusters, including the Education Cluster on disability inclusion.
This webinar is about how to better integrate disability inclusion in your HNOs and HRPs. Welcome. Right, so this is, I know you all know the HNO&HRP process. This is what it looks like. We're not going to go through all those steps, but you know it starts with agreeing on the scope of analysis, and that usually starts around June. It's a fairly long process, as I'm sure you're all aware. The purpose of this is just to remind you that when we say integrating disability inclusion in your HNO&HRP process, we don't mean that you need to add extra steps to an already quite long and complex process. We just mean that you include disability in the already existing steps. So at every step of your HNO&HRP process, you'll make sure to integrate disability inclusion in your activities, in your needs assessment, in your response framework, etc., etc.
Now, what we're going to be doing today is sharing with you some concrete tips on how to strengthen disability inclusion in your HNO&HRP process and documents. And that is based on a review of the education chapters of the documents that we did for 2021. So I'm just going to very briefly give you a bit of context to that work, because it's based on some work that is done more broadly in the interagency space. So since 2018, an interagency group has been working jointly to strengthen disability inclusion in HNO&HRPs. And part of that work has involved doing a review of those documents every year since 2018. The results from those reviews then feed into the support that we give to global clusters and to country teams, and it allows us to identify what are some of the good practices that are happening and what are the remaining gaps. So as part of this broader process, the GEC worked this year to review the education chapters and to look at specifically in the education chapters, what are the things that are going really well and what are some of the areas that we can strengthen even further. Next slide. So when we talk about doing this review of disability inclusion in the HNO&HRP documents, we have a number of criteria. So we have a number of really concrete things that we look for in terms of how disability inclusion is reflected. And what we'll be doing today is going through each of those criteria in more detail in relation to education. So for the HNOs, for example, we have data, we have reflection of diversity, we have how disability is included in needs assessments, just as a few examples. In the HRPs, for example, we have participation, how the HRP addresses participation by persons with disabilities, how the monitoring framework reflects disability inclusion, and how the objectives also include a description of how the response will affect persons with disabilities. Back to you, Anis.
So we're not going to go in details in each of the criteria that we use, but we've grouped some of them and we're going to walk you through them. So the first big axis of analysis would be the data one, right? So whether the HNOs present reliable data on person with disabilities, whether you're using the global estimate of 15% or you're using a different number, then how you justify it. And another aspect of that is whether you had in the needs assessment that you're using for your HNO, you included persons with disabilities. So for each of these criteria, we've selected a few good practices from a few country HNOs. You can read them below and we'll share this presentation with you anyway at the end. But for example, on data, Iraq disaggregated the PIN by using the 15% global estimate. In Syria, they use their own number, which is 7%, and they explain why they picked that number. And DRC did quite a good job mentioning how the needs assessment had actually included children with disabilities in their sample.
So in relation to the HRP, what we look at is how the HRP describes how it will respond to the needs identified for persons with disabilities. So for example, one of the things we look at is, as a basis for the HRP, does the HNO present the needs of persons with disabilities with a recognition of the underlying factors that contribute to those needs? So for example, what we often see is that the HNO may simply state children and adults with disabilities are among the most vulnerable, which doesn't provide us with a strong enough basis to design an inclusive response. So what we're looking at instead is that the HNO concretely describes the type of barriers children and adults with disabilities face, in this case to accessing education. In relation to the education chapters, we find that they're doing very well on that in describing the range of barriers that children with disabilities face. In the HRP, what we're looking for is that there's a twin track approach, what we call a twin track approach to addressing those barriers. So what we're looking for is that the HRP includes both activities that target specifically children with disabilities, as well as activities that focus more on mainstreaming their needs into the education response. So that would be, for example, addressing accessibility, addressing teacher training, etc. Again, this is something that we find that the education chapters of the HRP are doing quite well, and we have a few examples here from both South Sudan and Somalia. Back to you, Anis.
And the third angle for our review was the monitoring part. So this is both on indicators and objectives. So for indicators, most HNOs and HRPs that we reviewed had indicators that mentioned that the data would be disaggregated by disability, which is great. The other thing you could do is have indicators that are specifically targeting children with disabilities. That's something that we see a bit less, but in most cases, indicators mention that the data will be disaggregated by disability. So in the case of Libya and Burkina Faso, for example, we put two examples here. Number of school-age children accessing education facilities, and it mentions in parentheses that inclusivity will be looked at. And for Burkina Faso, all 6 indicators were mentioned collecting disaggregated data, which is great. And the other part of this is cluster objectives. In your HRPs, you'll mention your cluster objectives, and what we use as a base criteria is that there's at least a broad reference to persons with disabilities in at least one or more, ideally, of your objectives. For example, in Yemen, the first objective mentions inclusive learning opportunities. And in Cameroon, where the 4th objective is about improving inclusive education through teacher training. So we have 2 good examples here. There are more in the other HNOs and HRP. This is something that we see quite often. So that's really good. Kirsten.
Now, from this HNO&HRP review, we also identified a number of recommendations for areas that can be further strengthened for this cycle. So one of those, as Annie's already touched upon, is around inclusive monitoring. So this was an area where we thought there is scope for further strengthening by including both indicators disaggregated by disability as well as specific indicators. So what we've found from some of the countries that are doing this well is that specific indicators are important in order to track those activities that specifically target children with disabilities, whereas the disaggregated indicators are valuable in terms of tracking access to broader interventions. Another area that could be further strengthened is around diversity and intersectionality. So what we find is that children with disabilities are often presented as a more homogenous group, whereas some of the stronger HRPs, what we've seen is that they've been able to pull out the differences between, for example, girls and boys with disabilities or children with different types of disabilities. Excuse me. And the third area where we see some opportunities for further strengthening is around participation. So what we often see globally is that HRPs and HNOs tend to portray children and adults with disabilities purely through a vulnerability lens, whereas the response in particular could be strengthened by identifying opportunities to work with children and adults with disabilities and their representative organisations, so with organisations of persons with disabilities as actors in the response. Back to you, please.
And finally, we wanted to show you this couple of links that I think will be interesting to you. We've created a global repository on disability inclusion and education. This link is accessible to all, and we've been putting there any documents and guidance that's developed at global level, good examples from other countries that you can use to get inspired. And in that global repository, we've uploaded our disability inclusion review. So the full product of what we've presented here today, with all the HNOs and HRPs that we reviewed and good practice example for all the criteria. So I really encourage you to go and check that out. And you'll also find a guidance that was developed by REACH and other partners at global level on how to strengthen disability inclusion in MSNAs, which would also be helpful for other types of assessments. So really don't hesitate to use that if you have needs assessments or MSNAs planned in your countries. And finally, these are our contacts. Please don't hesitate to reach out. We'll be happy to help. Thank you, everyone, for your attention. Don't hesitate if you have any questions.
Thank you, everybody.